Welcome to Natural Beauty Summit's Love and Babies, a Health Journey. I'm your host, Salome Sallehy, founder of Sugar Wax, and my co-host here, Angela Chung, founder of Emdash Beauty. Today's conversation is all about pelvic floor health. Angela, tell us about our cool guest.
So today we're speaking with Kim Vopni. She is known as the Vagina Coach and is an author, a speaker, and a women's health educator specializing in all things pelvic floor health.
Yes, and you don't want to miss this conversation. If you're thinking to yourself, oh, I've never had any issues with pelvic floor health or postpartum or any of that, which is what I had thought, I was blown away by how much I learned in this conversation, because it's not just about birth and postpartum, it's actually a whole lifelong thing, and stemming from posture to all the things. So stay tuned for my conversation with Kim Vopni. Hello everyone, and welcome back to Natural Beauty Summit's Love and Babies, a Health Journey. I am so excited to be talking with Kim Vopni, the Vagina Coach, today about all the things that you need to know, but maybe you didn't know that you need to know them. So welcome to the summit, Kim.
Thank you very much for having me.
I want to kind of start with a little bit of like education, like just some basic pelvic floor health. I know that as women and many people in our audience, we've either struggled with it at some point if we've gone through the pregnancy thing. Maybe we've struggled with it without going through pregnancy, or maybe we're just like terrified of all the coming struggles because we're thinking about, conceiving in the future. Mm-hmm. So can you give us like a little bit of a baseline for pelvic floor health, and what are some of the signs and symptoms of pelvic floor like dysfunction?
Mm-hmm. Yeah, the pelvic floor is a really important group of muscles in the body that we've never been taught about, and we really deserve a lot more education than we get because it is so central to so many things that we do. So to give you a little bit of a visual here, I'm going to show you the pelvis.
I love the puppet. Oh, I thought you were bringing out the puppet.
I'll bring the puppet out in a moment, but so here's a pelvis, and we're talking about the group of muscles that closes off the pelvis. So these are our hip bones. If you've ever put your hands on your hips because you've been very crossed, these are your hip bones. And at the front here, we have a pubic joint. So people call this the pubic bone, but it is actually an intersection of two bones and it's a joint. That is an attachment point of your pelvic floor muscles. And if I turn this person around, here's the base of the, like kind of the low back area. This is the sacrum, a triangular bone that goes down into our tailbone. That's also an attachment point for our pelvic floor. And then if this person was laying down on their back, there's also two bones here called the sit bones. If they were sitting up, and if you pull the flesh of your butt cheek away, you should be able to dig in and feel a bit of a bony point. So those 4 points, that diamond shape, are all the attachment points for this group of muscles called the pelvic floor. And it's not just one muscle. It is 3 different layers, several muscles in those layers that support the spine and pelvis. So they're part of the core. They're the foundation of our core. We've all heard of core exercise. The pelvic floor is the foundation. They support our internal organs, the bladder, the uterus, the rectum. They manage the openings, the urethra, the vagina, the anus. They manage those openings and make sure things don't come out when we don't want it to. So pee, poo, fart, we want it to stay in until we want it to come out. And then the pelvic floor also allows it to come out. It allows a baby in vaginal childbirth to come out. It also allows things to come in, like a tampon or fingers or toys or penis, right? So the pelvic floor is intimately responsible for those openings, our sexual response as well. And the pelvic floor also works in synergy with our diaphragm. So every time we breathe, there's this sump pump action that helps with lymph and blood flow throughout the body. So these are really important jobs that nobody's told us about before. And especially as women, we menstruate. Many of us do become pregnant and birth a baby at some point in our lives. And all of us will go through menopause. And those are 3 really kind of pivotal times that all have a major influence on this group of muscles with regards to how the muscles respond and fluctuate and manage all of those jobs that it has. And so when it's working optimally, we just don't think about it. It's a part of the body that we don't see. I mean, we see the external genitalia, the vulva, but that's it. We don't see the in part. So we take for granted all of these things that are happening without us thinking about it. But then when things aren't working as optimally as we want them to, or they should be, we may experience things like incontinence. So when gas or stool or urine leaks out of us, we might experience organ prolapse. So the bladder, the uterus, the rectum have their proper anatomical positions. And if they start to bulge, like shift and start to bulge into the vagina, that can be, that's called pelvic organ prolapse. We might have pelvic pain. So it could be pain with sex, could be pain in and around those joints that we talked about. Could be constipation even. There's lots of things that we don't necessarily attribute to being part or a response of the pelvic floor until we start to learn about it. And then we think, oh, I've had this happening for many years, or I've experienced this for, ever since I've had babies. But you made an important point too, and that is that you do not have to have been pregnant ever in your life to experience any of these challenges that I just listed. And that's just kind of a small portion of them.
So does that mean that like men can have pelvic floor issues?
Yeah, men have a pelvic floor. Their pelvis is narrower than ours. It's a little bit kind of taller almost, if you will. Obviously, they don't have a vaginal opening. They don't have a uterus. So they're less likely to experience the conditions and the challenges that we have. But yeah, they can absolutely experience pelvic floor dysfunction as well.
Yeah. And, like some of the points that you touch on in your book, or I should say books, because there's a few of them, guys, you want to get your hands on this, but like you touch on like posture, lifestyle, age, hormones. And I never really thought about all of those markers as a part of, your pelvic floor health or having an influence on that. Can you talk about each of those a little bit separately? Because there's also like, your posture during pregnancy, which when I read that part, I was like, what? Yes. What are we doing? So that was really interesting to me. So I'd love to uncover some of that.
Yeah. So I'm putting my organs back into my pelvis so I can better illustrate this for you. But so here is the pelvis again, and now I've got the organs situated back in there: the bladder, the uterus. My rectum didn't quite lodge back in, but that's where it sits. And when we are in quote unquote neutral posture or neutral pelvis, we use not only the pelvic floor muscles to help support the organs, but we also take advantage of the bony scaffolding. So if you can see here, this is the pubic joint. So we talked about this from the front view. And here's the bladder, here's the uterus. And when I am in a neutral pelvis, which is where the hip bones are in the same plane as the pubic joint, and you would have a gentle curve of the low back here, I have this extra layer of support from the bony scaffolding of the pelvis. When I am in a tucked position, which is what I'm doing right now. Yeah, I know. That's a cue for everybody to start to sit up taller and straighter. But the majority, especially during COVID, what did we do? We sat on Zoom calls all day long. And eventually our pelvis was kind of like here most of the day. So we sit more on the tailbone, which can apply pressure and create some joint tension there. But also we now we're not leveraging that bony scaffolding. So there's more strain or tension or pull on the pelvic floor muscles. Now, again, that is part of their job, but we need to use all of the support aspects that we have. So sitting and standing in a neutral pelvis for the majority of the day would be considered more optimal. Now, that doesn't mean that you can't ever slouch and lean back on your couch. And, of course you can, but if that's where you're spending the majority of your time, your muscles are going to adapt to that. The other reason why kind of a tucked position is not ideal is I'm going to show you this pelvis now without the muscles. Okay. So here's that sacrum and the tailbone. Here's that pubic joint at the front. Here's the two sit bones. Here's what it looks like without the muscles. So we have that pelvic, that opening. It's called the pelvic outlet, and the top of the pelvis would be called the pelvic inlet. And that group of muscles is closing this space off. Now, if I'm in my neutral pelvis and I'm sitting, you can see that my tailbone is free from that surface. And that's great. And if I was to then sit more tucked, if I'm on my chair here, there's now pressure on my tailbone. And because this is part of, we have a joint in the tailbone, and we also have joints here on the side of our sacrum. There's a little bit of movement there. And if I encourage those joints to move closer to the pubic joint, I close that space off, and the muscles then start holding on to more tension. So they're not at their optimal resting length. And muscles that aren't at their optimal resting length don't have as much power. They get tired and achy. And when they are called upon to do something, their reaction time may not be so great. So if I always equate it to the arm. So if this is here's my bicep muscle. This is if it's down at my side straight, that's my normal resting length. But if I was to walk around with my arm bent, potentially carrying a bag of groceries for the day, I become very tired. It becomes achy. And if I then needed to do something with my bicep, it would be delayed in its response because I've already been working extra all day long. And part of my force, so if my full range of motion is that, and I've already used up part of that range of motion, I don't have as much force left. So that same thing can happen in the pelvic floor. And if we are sitting in that tucked under state and contributing to shortening of that group of muscles, that interferes with that optimal resting length where I have full power and full reaction time. Does that make sense?
Absolutely. And I thought it was interesting because these are internal muscles, right?
Mm-hmm.
So when we have our external muscles, we know that if you shorten the muscles through whatever repetition, you need to also lengthen them through stretching. But that's not so easy to do with the internal muscles because, we're going to talk about this, how to contract and release them and access them. But it's a lot of really important jobs for just daily functions that are now being fatigued. So how do you stretch your pelvic floor muscles?
Mm-hmm. Yeah. So the one point on there that I'll kind of elaborate on is you said we don't see these muscles, they're inside. So we need some imagery and some visualization and even some potentially internal feedback to help us access this group of muscles. There's biofeedback devices, but I think the gold standard is pelvic floor physical therapy. So if you take one thing away from this episode, find and book in with a pelvic floor physical therapist. It'll totally change your life, and then go see them once a year. Just like you see the dentist for your teeth, you're going to see them. So that's kind of the gold standard in terms of accessing that group of muscles. They look at posture. They look at how you breathe. They look at how you move. And just like any other muscle in our body, we need a component of strength. We need a component of endurance, and we need a component of suppleness and the capacity to relax. And when we think of Kegel exercises, a lot of people are like, oh, my pelvic floor is weak because I'm leaking. Therefore, I must need more strengthening and I'm supposed to do Kegels. And it's not, the interpretation is that it's just a squeeze, but we need a squeeze, a lift, and a let go. We need that release component, sometimes even more so than the contract and lift. And as you say, I can see when my arm is lengthening and relaxing and stretching, and I can see when it's contracting and shortening, but I can't necessarily see that happening in my pelvic floor. So it becomes this elusive, I don't know, am I doing Kegels? Am I not doing Kegels? And we have evidence to show Kegels work really well when they're done correctly and when they're done consistently, but most people are doing them incorrectly because nobody has taught them how to do them. And so stretching can involve just using the breath. It can involve different leg and hip positions. It can involve using things like a tennis ball to kind of apply counter pressure in certain areas. So those are all ways to release the pelvic floor. Also, if you see a pelvic floor physio, they can do internal kind of like we get trigger point release in our neck and shoulders. They can do that too.
Wow. Yeah, Kegels was going to be actually the next thing I want to dive into, because it's kind of like every doctor, if you're going through pregnancy, will tell you you need to do your Kegel exercises. And from what I know, and correct me if I'm wrong, it's kind of like holding your pee, right?
Kind of. Yeah.
Yeah, so I would love, like, if someone in our audience has never done a Kegel exercise, can you just walk them through it?
Yeah, for sure. So Dr. Arnold Kegel was the person who sort of invented Kegels, and he was using a biofeedback device with his patients who were experiencing challenges contracting and relaxing their pelvic floor. And this biofeedback device was called a perineometer, and it was essentially like a little balloon that was inserted. And when people would contract and lift and then let go, it would register on a gauge. So they would be able to see what their muscles were doing, even if they couldn't necessarily feel it or weren't quite sure if they were doing it correctly.
Doing it
So that's
right.
kind of how a Kegel started. But what's happened over the years is people are like, oh, Kegels to strengthen. So I'm just going to squeeze, and I'm going to squeeze harder, and I'm going to hold it. And they forget about the lift, and they also forget about that letting go. And as I was talking about here, if I do more squeezing when I'm already in that shortened position, I'm just going to add more tension. Really, this is what I need to get more power and to facilitate better reaction time. So the pelvic floor, we need it to respond at the right time with the right amount of force, dependent on the activity or the reaction it needs. So like a cough or a sneeze, or lifting a weight, or standing up from a chair. We need the pelvic floor to respond to that movement at the right time, and then with the right amount of force to manage those openings. And so a Kegel exercise is designed to ideally to optimize the reaction time and the reaction force, basically. And we need an understanding of its relationship with the breath, I believe, to properly teach it. So here's the pelvic floor. Here's our diaphragm. So this is our breathing muscle, okay, up here. And we would have our abdomen, our deep abdominal muscles here, and then we'd have some muscles along the back. I call them the core four. And here's your pelvic floor. When we take a breath in, the diaphragm flattens and lowers, and it draws air into the body, and it wants the belly to expand, and it wants the pelvic floor to expand. So this should happen on an inhalation. Inhales where the pelvic floor relaxes and lengthens, and the exhale is where the quote unquote Kegel part comes in, where there's that contract and lift of the pelvic floor as the diaphragm also rises back up. So just inhaling and thinking of lengthening, I think of blossoming the vulva. Let me get my big vulva out here. So when you inhale, if you can think about the vulva blossoming almost, you can think about your labia like lungs, and they fill up with air. And then when we exhale, that's when we are going to add in that extra imagery and visualization. A very commonly liked visual is to think about picking up a blueberry with your vagina and your anus. So if they think about there's a little blueberry here, and then the anus would be down here, and they could think of another little blueberry, and they're going to pick the blueberry up and lift it up into the body, and then they're going to let that blueberry go.
Wow.
A lot of people do it in a seated position. So you'd think of, and now your vulva is not literally, grabbing a blueberry or sucking it up, but it's just a way for people to visualize something there that they gently they grab, there's a squeeze, and then there's a lift to pull it up into the body. And then there's a let go. And that's the part that people forget about doing. The other thing I'll just say before we move on from that is, while pelvic floor physical therapy would be considered the gold standard, we have our own biofeedback with our fingers. Or if we have a partner, and a partner has fingers, or potentially a male partner with a penis, any of that, our own finger or their finger or penis can be inserted into the vagina. And then we are going to do our visualization. So we could try blueberries. You can also think about sipping a smoothie through a straw with your vagina. And what you want to feel is like a gentle little hug of the fingers, a gentle draw up, and then that release. So you can ask your partner to provide you that feedback, or you can feel it on your own fingers.
One of the things that I think might be confusing, because everyone's got a different number, is how many Kegels you should be doing, at what stage, or how often. Like what's a typical set of Kegels? How many sets should you be doing to prepare for childbirth? You know what I mean? Is there like an optimal range that you have found that works?
Well, if you look at research would say 3 sets of 10-second holds done 3 times a day. So that's what now, and that is more research for people looking to overcome a problem. My take on Kegels are, while that is okay, evidence-based, there's not very many people who are going to take out 3 separate times in their day to do 3 sets of 10-second hold Kegels. And the limiting factor on that is it's not training the pelvic floor functionally or dynamically. So most people are doing them sitting in a car, brushing their teeth while they're watching TV. And when they're done correctly, that's better than nothing for sure. But a lot of people, when they start to experience symptoms, it doesn't happen when they're brushing their teeth or sitting in a car. It happens when they lift up their baby, or when they are coughing, or when they're doing resistance training.
Yeah.
So we need to train that reaction time and force as part of dynamic movement. And so I don't prescribe 3 sets of 10-second hold 3 times a day to people. I have them do it as part of their functional movement, like squats, like bridges, like bicep curls, like push-ups. And we can then harness training the pelvic floor dynamically with different loads. We can progress people through that. And when we think about specific to pregnancy, we want to do movements that's also preparing us for not only for the birth, but also for motherhood. So there's different birth positions that I would train people and have them contract and relax their pelvic floor in. So tall kneeling positions, all fours positions, squat positions, side lying positions. And then I'm also having them do movements like lifting and carrying a car seat, lifting up a laundry basket, rotating with a load, because that's all movement that is going to mimic the demands of motherhood. And then the final thing I'll say with regards to Kegels and pregnancy is in the final weeks, around the time we start perineal massage, usually like 35 to 37 weeks, I recommend they do a slight shift where they, instead of picking up blueberries on their exhalation, they practice exhaling while keeping the space open and free of tension. Because when we're actually in the second stage of labor and we're pushing, we don't want the pelvic floor to be picking up blueberries. We want the pelvic floor to stay open and free of tension. And then once the baby is born, they return back to the regular way to do it.
That is such a good tip. Like the pelvic floor has so many different functions. During pregnancy is holding all your stuff together. During childbirth, it's what you just talked about, like pushing the baby through and hopefully without damaging mom too much. And then, motherhood does, like, that's the reality. It changes your daily habits so much. And then you've got this baby that you're carrying around a lot, and your neck and shoulders, but also your pelvic floor are part of that. You also talk about menopause. So, like, how does the function of, how would you elaborate on the important functions of the pelvic floor through all these different stages? And let's talk about menopause for a minute too, because we touched on it earlier, but that impact of hormones on the pelvic floor, I'd love for you to talk a little bit more about that.
Yeah, so I'm going to come back to pregnancy just for a second and then sort of talk about the evolution up to menopause. So when I was talking about posture, when we are pregnant, we have this belly that's growing out in front of us, and it starts to alter our center of gravity and how we hold ourselves. And the natural tendency is so initially, as the belly is growing out in front, it's like a tendency to become more anteriorly tilted in the pelvis. But then as it becomes even more in front of us, it's like we're leaning back and sort of pushing the pelvis forward to try to counteract this big weight. And so that's bringing us in more of that posterior tilt. And then what happens after we give birth is the body doesn't just go whoop back to where it was. It has adapted over the 9 months to those new habits. And then in that early postpartum, when we have now a huge decline in estrogen, we start breastfeeding. Estrogen is really important for the pelvic floor. And so that's kind of like a glimpse into what can happen in menopause, where we have those steep declines of estrogen and we start to experience maybe some burning, some itching. dryness, maybe some discomfort with sex. And a lot of it has to do with estrogen. It can also be the posture changes that happen, and maybe we have more tension in the pelvic floor. And so in order to have a good sexual response, we need the pelvic floor muscles to be able to relax and have good blood flow and circulation. So there's a couple of things that play there, but estrogen is a big one to talk about because it directly influences the tissues on the inside. And then we start to navigate into perimenopause. So perimenopause is the 6 to 10 years-ish prior to the 1 day of menopause. So menopause is 1 day, and it marks 12 consecutive months without a period. So once you have 12 months without a period, that 1 day, that anniversary is your menopause. 6 to 10 years up to peri. After you reach your 1 day, after that is post-menopause. So in that fluctuating time of perimenopause, we have sometimes we don't ovulate. Starts to become an imbalance between estrogen and progesterone. Sometimes we actually have what would be considered estrogen dominant. So even though we may not have an excess of estrogen, but because we're not ovulating, we don't have the progesterone to offset it, the ratio becomes a little bit off. And so then we have maybe some early signs of vaginal dryness, or maybe incontinence is showing up for the first time, or maybe getting worse because it showed up before. Maybe we start to have more UTIs. Maybe we have prolapse comes on for the first time. So that fluctuating state is kind of not always impacting the pelvic floor as strongly, but as soon as we reach menopause and move post-menopause, and now we no longer are producing estrogen, the tissues in and around our vagina, I'm sorry, I have a notification that keeps going off. I'm sorry if you hear that. The tissues in and around in our vaginas, in and around our bladder, there's so many estrogen receptors. And when we no longer have estrogen circulating, those tissues then become thinner and drier and more prone to infection, because it also changes the pH in our vagina. It becomes less acidic. And that's where, if we've dealt with maybe little bits of incontinence or prolapse symptoms or kind of discomfort along the way, and now we reach this, end of estrogen production, now all of a sudden those things are showing up either for the first time or becoming more pronounced and more bothersome. So there's an umbrella term called genitourinary syndrome of menopause. And that's vaginal dryness, vaginal atrophy, the thinning and drying of the tissues, incontinence, organ prolapse, UTIs, itching, burning, painful sex, dyspareunia, like a whole host of things that influence the vagina itself. And a huge reason for that is from estrogen.
And is there something like women can do about this? Is this like hormone replacement? Is that what that's for? And, are there other things that we can do that don't involve drugs?
Yeah. So I think there has been a lot of fear created around specifically estrogen. And a lot of that stems from the Women's Health Initiative study. And what has now come out, it's very well publicized, that there was a lot of flaws with that study. And estrogen was made out to be this terrible thing. And really, estrogen is incredibly beneficial for our brains and our hearts and our bones and our muscles and our vaginas and our skin. And there's really very little, danger to me is just not the right word. If you think of alcohol, people who drink alcohol, a lot of women drink alcohol, drink red wine, that increases your risk of breast cancer and heart disease. And a lot of people are afraid of estrogen, but they continue to drink alcohol. And really, just removing alcohol could put you at the same baseline risk. So I'm not going to go into all the research here. It can get kind of complicated, but I want to rest people's minds that especially vaginal estrogen, where it's inserted into the vagina, there's zero link to any cancers of any kind, zero link to any heart conditions. It stays local to the vagina and really influences the tissues. So it's not going to help with things like hot flashes and your bone health and your brain, but it will help locally with the incontinence, burning, UTIs, that kind of thing. So I believe, based on the evidence and many of the evidence-informed physicians that I follow, starting vaginal estrogen around the time of your menopause, potentially sooner if symptoms indicate, and being on it for the rest of your life is a really important step in terms of preserving the integrity of the tissues in and around the vagina, in and around the bladder.
Wow. I was not expecting to hear that. Now, you, as the vagina coach, are coaching women through, probably different stages and, different issues. One of the things that I keep hearing about, and I'd love to get your validation or not on it, is even if you don't have symptoms, like taking care of your pelvic floor is really important. Do you find that people come to you when it's already too late? Like they're deep in irreversible symptoms and they're like, Kim, fix me, or are you finding that, like if you were to share some advice, what can women do right now to mitigate some of the damage? I don't know. What are your thoughts?
Yeah, I have always been a believer in preventive health, and it's how I got into this line of work. I was afraid of childbirth. I was afraid of tearing. My midwives recommended a product to me called the Epino. I became a distributor for this in Canada. I was a distributor for 14 years until the product, that's a long story, but Health Canada implemented a new regulation that was costly and a lot of hoops to jump through, and the smaller manufacturers chose not to go through that expense and steps. So this company left Canada. But that was my introduction.
What is
it's called the Epino.
What does that mean?
So Epino is a short term for no episiotomy. And I love this device. I feel so brokenhearted that it's no longer available in North America. It's still, you can purchase it if you know somebody in Europe, if you know somebody in Australia, but politics are getting in the way. But it's a fantastic product. I love it. I love it. I love it. And so that's what I used. And I thought I had such a good experience. And I know that it contributed to my birth outcomes. Why is it that not every single person is using this when they're giving birth?
What does it do?
It's kind of like the periometer that Dr. Kegel had. So it's a silicone balloon. It's attached to what looks like a blood pressure gauge almost. And when the balloon is inserted into the vagina, you pump a little bit of air into the balloon. So it gives you like something to squeeze against. And when you contract and relax, like that blueberry picking up and letting go, it shows on the gauge the contraction and relaxation of your pelvic floor. And then in the final few weeks of pregnancy, you leave it inserted, and now you're going to inflate it to the point where it creates a bit of discomfort and stretch and pressure, not pain, but it's trying to bring in the sensations that you're going to feel when you're birthing your baby. And your goal with that training is to impart those sensations and then learn how to relax and release tension, even though you feel like, oh, it feels uncomfortable. And you do that in the final weeks of pregnancy. And studies show users versus non-users have a higher rate of intact perineum. So that was my first introduction to the world of pelvic health. And I started selling this product, and then pelvic floor physical therapists started to refer to me. And then I was like, what the heck is this pelvic floor physical therapist? And as soon as I learned what they do, I thought, now I'm screaming from the rooftops about not only this product, but also the work that they're doing. And so I've always come from a very, let's prevent a problem from happening point of view. That being said, I formed a second business called Bellies Inc. And we were wanting to get first-time pregnant moms. And it was more about, it was wrapping the abdomen and pelvis postpartum. And our biggest customer was the second-time mom. Same with the Epino, actually, second-time moms, because people don't think, like, they feel fine, they're fit, I'll be fine. I'm going to be fine. And there's no problem to fix. So they're not as motivated to take steps from a prevention perspective. There are some people like myself that I believe that that's really important. And so I also looked at perimenopause and menopause, and how can I make sure that I have this pelvic health status optimized for the rest of my life. And so, yes, the majority of people come to me when a problem exists. It's never too late, though. I would say, yes, some people come to me with like very advanced prolapse. They've been leaking for years. They have vaginal dryness. They've got a whole host of things. There is so much that we can do. It's never, ever too late to come in. And a lot of people then say, well, I'm probably too late for me. I need surgery. Or some people even early on think, well, I'm just going to get the surgery because it's just easier. And even if you have, I say, especially if you have surgery for incontinence or organ prolapse, you need pelvic floor exercise and estrogen and vaginal moisturizer and all the other things we're talking about, even more than the person who's working preventively. So from an optimizing pelvic health perspective, whether you're looking to overcome symptoms or whether you're wanting to prevent them from happening in the first place, pelvic floor exercise, whole body approach. So that's my approach, where I don't mean just me, but a lot of people believe the same thing, but a dynamic approach to pelvic floor exercise where you're contracting and lifting with movement is my ideal. We then want to moisturize our vagina like we do our face. We spend so much time and energy preventing wrinkles and wanting them, treatments and therapies. And our vaginas, they like collagen, they like hyaluronic acid, they like some treatment and kind of massage like we do on our face as well. So moisturize your vagina, and that can happen at any time. Estrogen, I talked about. I believe pretty much every single vagina would benefit from estrogen around the time of menopause, unless symptoms indicate earlier. And pelvic floor physical therapy once a year, even if you have no symptoms, and especially if you do. And then there's things like, people will ask me about vaginal weights, yoni eggs, the lasers and stuff that are at a lot of the med spas, and they can all play a role. But before you invest in those, and a lot of those are quite pricey, invest in pelvic floor physical therapy first, because that will help you understand what your pelvic floor actually needs. Do you need more activation? Do you need more of the kind of working on the lift? Do you need more endurance? Do you need more relaxation? Because if you need more relaxation and you put some Kegel weights in, that's not going to help you relax. That's going to help you add more tension.
Yeah. And you touched on something that I thought was interesting was, even if you're not having symptoms, like take care. Is that something that you should be thinking about like prior to even conceiving? Is that just like feminine health 101? Is it like post motherhood 101? Like at what point do you introduce this type of care into your wellness routine?
Yeah. I would argue that when we are teaching girls, teens, about menstruation, sexual health, body awareness, body health, and not just girls, like teens, when we are teaching the young people about the bodies and about sexual wellness, why are we not talking about this important group of muscles that it is like vital to so many of the things that we do and encounter throughout our lives? So in an ideal world, talk to our kids about pelvic health from an early age, and talk to them about pelvic floor exercise, why this group of muscles is important. And suggest that around the time that they become sexually active, they start seeing a pelvic floor physical therapist. We've been conditioned from a young age to see a dentist once or twice a year. We brush our teeth, we floss, we go see the dentist, and we go if we don't have a toothache. We go if there's no issues. We just go because we have to have our checkup. And I think we need the exact same PR for our pelvic floor. So once we become sexually active, we go see a pelvic floor physical therapist once a year, check in to see, are the organs in their proper anatomical position? Is the muscles contracting and relaxing in a balanced way? Has the person started, or are they having any challenges with their menstrual cycle? So we think about things like adenomyosis and endometriosis becoming a lot more talked about in the world. That's another way where we can start it's not normal to experience those, but to normalize the experience of them, and to give people tools that can help them, rather than the years of suffering that so many of these people do because they think that periods are just supposed to be painful. So I think the younger the better, and I think we should be teaching pelvic health in schools.
I love that. And I'm definitely going to put it on my list of to-dos with my kids. I do want to clarify something. Now, you talked about like skincare for your vagina. Are we talking about like lubricating the inside of like the actual vagina, or are we talking about vulva skincare? Because I've heard Like we actually had a guest in our last summit that talked about like skincare for the vulva.
Yeah.
So what are some of the key differences, and what are some of your favorite vagina / vulva care routines?
Mm-hmm. So there's lubricant that is for sexual activity with or without a partner. And if you're using toys, silicone-based toys, you'd want to have a water-based lubricant, and ideally a shit-free lubricant. So ones that has very little irritants, possible irritants in there. Yes, personal lubricants, liquid organics. There's another one that's just on the tip of my tongue, I can't think of, but there's a few kind of clean, organic, not a lot of crap in them lubricants that I really like that are good for with or without toys, with or without a partner. Then there's moisturizing the vagina, and hyaluronic acid is the main ingredient that we're looking for. And a lot of people say, oh, well, I use a hyaluronic acid serum on my face, I'll just put it on my vulva. And if it's just hyaluronic acid, yes, but a lot of the stuff we put on our face has other additional ingredients. So the one from moisturizeyourvagina.com is the one that I like the best. It's hyaluronic acid and vitamin E, so it's very clean. Sorry about that. So that's the one I like. There's Repagyne is another one. Reverie is another one. Those are a few different hyaluronic acid based moisturizers, and they can be gels or creams, or they can be little like ovules that you insert, like almost like a little pill, and typically you put them in at night. The creams you can use during the day though, and they can be used internally and externally. And so some people who maybe experience sort of burning and itching ish through the day may want to use something that it's not just used at nighttime. So ideally with moisturizer, it's inside and outside. So you insert some either with your finger or an applicator, and then you can apply some externally to the labia as well. There's also like they're a little thicker. They're more like a salve. And V Magic is one that I like. What other one? I have to look up at a little collection over here. That's one of the main ones that I like. There's Intimate Rose has one that I really like as well. And those are more not for internal, but just for external use. So the tissues in the perineum, so between the vagina and the anus, can sometimes even around the anus, but you can go from clitoris to anus with, Julva is the other one that I wanted to mention. Julva is actually a vaginal DHEA, so it's non-hormonal, but helps with the conversion of estrogen and testosterone. And it's applied externally. That one's more of a put it on at night. It can help soothe and treat in a way. And the other ones like the V Magic and the Intimate Rose can be used during the day as well to kind of keep things more supple. And then there's estrogen. So as I mentioned earlier, estrogen, I think, is something that's very beneficial for everybody. And I don't want people to look at it as like there's bioidentical hormones, which are the same chemical structure as our bodies. And then there are synthetic, but that's confusing too, because bioidentical hormone is still technically synthetic. It's still manufactured, but it just uses different ingredients, if that makes sense. So I prefer bioidentical. And that really helps preserve the integrity of that tissue. So those three together, estrogen, moisturizer, and lubricant, all serve their own individual unique purposes, and they all have a role. But lubricant is not going to keep you moisturized. Moisturizer is not going to be good for a lubricant. Estrogen isn't going to always keep you lubricated and moisturized as well. It helps with that. But I think a combination of all three is the best.
Wow, I really have to up my vaginal care routine here. I had no idea most of these products even existed. And it makes so much sense because, when you think about it, like we care so much about like the integrity of the skin on our faces and, our muscles on our body. But like there's like a whole other system that we need to be paying attention to because it has so much impact on so many facets of our life.
Yeah.
So thank you so much for that. I'm going to ask you to share some of these links so that I can include them in the show notes, so that our viewers and listeners can also find their way to their better routine. Any final words that you want to leave our audience with? You have shared so much. I so appreciate it. But any last little like nugget or one thing that you must remember?
I guess so. Light bladder leakage, or, feeling like you need to go to the bathroom in time, that is not just part of being a woman. It's not normal as we age. One thing we had forgotten to talk about, as we age, we also lose muscle mass, and we have muscles in our pelvic floor that we've been talking about this whole time. So that loss of muscle mass as we get older also influences our pelvic floor. So moving, exercise, whole body exercise, pelvic floor exercise. I am a believer in collagen supplementation. I think that all helps with preserving the integrity of that and helps avoid that muscle loss. But I want to leave people with the message that it is not normal. It is very common. You're not alone in it. It is never too late. It is not something you need to suffer with. It is very treatable. Like pelvic floor dysfunction is so treatable. And if you accept pads as your destiny, you will spend upwards of $70,000 over your lifetime. So think about how much money you would have in your bank if you didn't have to wear pads, and think of the savings to the environment as well. So wholeheartedly spend the $120 to see a pelvic floor physical therapist once a year and do pelvic floor exercise. It can be as low as $30 to learn how to do them, and then you keep up for free. You just do them yourself. So I deserve it. I think it deserves a lot more attention than it gets.
Well, thank you so much. And thank you to our audience for tuning into this really important conversation about health and vaginal wellness. And we'll share links to find the Vagina Coach Kim. So if you have any one-on-one questions you want to ask her, feel free to reach out, and those will all be in the email. Thanks for tuning in.